No morning erections this week? Your heart might be talking, and I want you to hear it clearly. I'm your urology guide today, and I'm going to show you why erectile dysfunction is so often a vascular warning sign, and how to use that warning to protect your energy, your confidence, and your life. Stay with me to the end, because you'll get a simple 12-week plan that improves blood flow, helps many men get their morning erections back, and lowers cardiovascular risk without hype or gimmicks. Here's the reality you won't hear in ads. An erection is a blood flow event. Your endothelial cells, the inner lining of your arteries, release nitric oxide. That signal relaxes smooth muscle, arteries open, blood fills the chambers, and valves keep it there. If high blood pressure, high blood sugar, smoking, extra belly fat, or chronic inflammation injure that lining, nitric oxide falls, arteries stiffen, and erections fade. The penile arteries are tiny. Small pipes clog before big ones, so ED can appear years before chest pain. When the bedroom starts sending you error messages, check the engine, not just the dashboard. Listen for the red flags: a slow, steady decline over months instead of a single bad night. Fewer or absent morning erections, which are a sensitive barometer of vascular and nervous system health. Shorter stamina. Co-travelers like a soft belly that sits over the belt, blood pressure creeping above 130/80, LDL that's higher than you'd like, a fasting glucose or A1C that's nudging upward, snoring with daytime sleepiness, or a family history of early heart disease. None of this is a verdict. It's a nudge to act while the problem is still early and fixable. Do a quick self-check today. Think about the last 10 mornings. 0 to 2 morning erections is a concern. 3 to 5 means keep watching closely. 6 or more is reassuring, but not a free pass. Wrap a tape around your waist at the navel. Over 40 inches is a strong vascular risk signal. Take 3 home blood pressure readings on different days. If you're consistently above 130/80, write it down and bring it to your clinician. Check your resting pulse in the morning. Above the high 70s or 80s often means your system is working too hard. If your partner says you stop breathing at night, screen for sleep apnea. Treating it can restore energy, mood, and erections surprisingly fast. Let's knock down a few myths before they knock you down. It's just low testosterone. Sometimes hormones matter, but for men over 50, most ED is vascular first. Fix circulation and lifestyle, then check morning total and free testosterone to fine-tune. If a pill helps, I'm fine. PDE5 inhibitors are great tools for symptoms, unless you take nitrates, which is dangerous, but they don't repair plaque or endothelial injury, so you still need a heart check. I'll lose weight first and then see a doctor. Please don't wait. Get evaluated now, then lose weight smarter with a plan that actually targets the cause. Here's the sentence to say at your appointment. I'm getting fewer morning erections and progressive ED. I'm worried about endothelial health and atherosclerosis. Can we check my cardiovascular risk? Ask for blood pressure, waist, fasting lipids, A1C, kidney and liver panels, and morning testosterone when appropriate. If your overall risk looks moderate, discuss an ECG and, when it fits your case, a coronary calcium score to refine decisions about prevention. If you screen positive for sleep apnea, test it. CPAP can be awkward for 2 weeks and then life-changing. I'll share what men tell me when they follow a vascular first plan. I cut the nightly alcohol and walked after dinner. My morning erections came back in about a month. CPAP was annoying until it wasn't. My energy snapped back and so did firmness. Light weights twice a week helped me sleep deeper. Mornings improved in a few weeks. These aren't promises, they're patterns. Your results depend on your health and your consistency, but they're common enough to take seriously. Now let's build a 12-week protocol that turns ED into a recovery signal instead of a threat. In the first 2 weeks, chase easy wins. Walk 7,000 to 8,000 steps most days and add 2 short incline bursts of 30 to 60 seconds during a walk. Little spikes wake up nitric oxide pathways without crushing fatigue. Twice a week, do short strength sessions that hit the big patterns: a hip hinge, a sit-to-stand squat, an incline push-up, and a band row. Big muscles improve insulin sensitivity, and better insulin handling protects the endothelium. In bed, try a simple breath cadence: 4 seconds in, 6 seconds out, for 5 minutes. It lowers sympathetic tone and helps erectile reliability. Wake at the same time daily. Cut alcohol on weeknights. Your sleep, hormones, and morning erections will thank you. Eat like you live near the Mediterranean. Vegetables and olive oil at most meals, fish twice a week, beans and nuts often, whole grains when you want starch, and berries with yogurt instead of dessert most nights. Review your medicines with your clinician. Some blood pressure drugs, some antidepressants, and some prostate medications are not erection-friendly, and there are often alternatives. If your heart meds allow it, a PDE5 inhibitor can support function while your arteries heal. Again, never mix with nitrates, and be cautious with alpha blockers. Weeks 3 and 4 are about building nitric oxide and smoothing glucose swings. Add a daily habit of beets and dark greens. Your body turns natural nitrates into nitric oxide. Take a 10 to 15-minute walk after dinner to flatten post-meal glucose spikes. Your endothelium loves that. Spend 5 minutes a day on pelvic floor training: 10 quick pulses for power, 5 slow 5-second holds for endurance, and 5 full relaxations for sensitivity and control. Most men overuse abs and glutes. Keep them quiet and focus on the lift and release you'd use to stop urine, then let it flow freely. Weeks 5 through 8. Turn dials, don't yank levers. Bump strength training to 3 brief sessions a week, still focusing on hinge, squat, push, and pull. Aim for roughly 1 to 1.2 grams of protein per kilogram of body weight daily. Adjust with your clinician if you have kidney concerns, because preserving lean mass means better glucose control and better blood flow. Cap alcohol at 2 drinks a week. Many men notice stronger mornings 2 to 3 weeks after cutting back. If you're overweight, target a steady 1 to 2 pounds a week. As the lower belly fat pad shrinks, visible length often improves and erections feel more reliable. Weeks 9 through 12. Consolidate and reassess. Recheck home blood pressure, waist and resting pulse. Repeat labs if your clinician requested them. Ask yourself, are morning erections returning more days than not? Does rigidity feel better? If progress is slow, escalate with your care team. That might mean optimizing cholesterol medications, adding modern metabolic drugs if you have diabetes or significant overweight, treating sleep apnea, or adjusting blood pressure therapy to options that are friendlier to erections. If you're tempted to ask for the fastest route, here's how to shorten the runway without crashing the plane. Cut ultra-processed foods and sugary drinks. Glucose spikes hurt your endothelial function. Put most of your starches after walks or workouts. Train your exhale. Long, easy out-breaths calm adrenaline and help arousal. Fix the bedroom environment. Cool, dark, and quiet, with screens off early. Late blue light blunts melatonin and disrupts testosterone rhythms. Double-check over-the-counter products. Some decongestants and antihistamines can make things worse. Ask your clinician. ED isn't always vascular, and it helps to know the exceptions. If everything fails suddenly during one stressful episode, but morning erections are normal, it's likely psychogenic. Sex therapy and performance anxiety tools can help while you still run the vascular plan for insurance. If you have painful curvature or feel a plaque, think Peyronie's disease. Early evaluation matters. If you've had pelvic surgery or nerve injury, rehabilitation is different and may include early therapeutic pump use, medications, or injections alongside pelvic floor work. If libido is low with fatigue and few spontaneous or morning erections, endocrine issues might be part of the picture. That's when morning total and free testosterone, thyroid, and prolactin testing can clarify the next step. Use a simple rule of thumb for referrals. If you have new or worsening ED and at least 2 of these, age over 50, hypertension, high LDL, diabetes or prediabetes, current or past smoking, sleep apnea, or a family history of early heart disease, ask for a cardiology workup or risk stratified plan. You're not chasing a pill, you're preventing a heart attack or stroke while you restore function. Here's the hopeful bottom line. ED is often your earliest alert that the vascular system wants attention. Don't ignore it and don't mask it and move on. Use it. When you improve your arteries, you don't just help sex, you help your lifespan. The plan is simple, not easy. Walk most days, lift a little, sleep enough, eat Mediterranean, treat apnea, adjust medications wisely, consider a PDE5 inhibitor as a tool when safe, and keep your follow-ups. The results are worth it. More energy, steadier mood, stronger morning erections, better confidence, and a heart that's harder to scare. Start tonight. After dinner, take a 10-minute walk. Do 5 minutes of pelvic floor practice. Skip the alcohol. Lights out on time. Tomorrow, message your clinician for labs and a check-in. A month from now, look back at where you started and notice how different your mornings feel. This is how men in their 50s, 60s, and beyond win the long game, by listening early, acting steadily, and letting better blood flow change everything.